Hello, my name is Dr. Alex Martin. I'm the medical director at PureCell New Life Solutions. Today, I would like to tell you some more about our new developments in cellular biology. We know that there are three marketable types of stem cells which are available now. There's the stem cell from the fetus, there's stem cells from MSC, which comes to the placenta, and the third type of stem cell is from fat transfer or from liposuction. We use MSC, that's mesenchymal pluripotential stem cells, because they are the best. We know that they work and they're easily obtained and they're fresh, and we have frozen varieties as well. So the fat cells, derived stem cells, are not effective because they have already started down the path of differentiation. They've already become the organ that they're targeting. So they're not as effective as the MSC cells. The fetal stem cells are unreliable and difficult to obtain. The mesenchymal pluripotential stem cell, we call MSC, is very, very useful. It's the heart of our stem cell practice. We use it often to inject into joints to repair torn cartilage in the knees and shoulders and hips. We also use it many, many times to repair tendons and soft tissue injuries where muscles have been injured or tendons and ligaments have been injured and need repair. Other times we use it for diseases of the skin, so that it's useful in repairing skin disease and scar tissue as well. Now we're using stem cells of this type, MSC, also for hair loss and to regenerate hair. So there are many, many functions that we are discovering every day for MSC type cells. The groups of patients that we unfortunately have to exclude from stem cell therapy are cancer patients who are being actively treated with chemotherapy and radiation therapy. Those patients should really not have stem cells until they're cleared by their oncologist. Other groups that should not have stem cells are pregnant women and individuals with open wounds that are infected. Many people ask me why stem cells cannot be used to cure cancer. The problem is the stem cells are very immature, undifferentiated, and that's why we like them. As a result, they cannot recognize bad cells like cancer cells. They have no ability to detect the markers on the surface of those bad cells. Another question is, how long will the stem cells last? The answer to that question is, once the stem cells are injected, they replicate, meaning they multiply in great numbers, and they attach themselves to the damaged tissue. Then they become that tissue. So sometimes one injection is enough. Other times it takes 3 to 4 injections over a certain period of time. This again depends on the area that's been damaged and what the data shows up on the MRI or X-ray. Stem cell therapy is a very safe procedure. So when we inject the stem cells, they've been tested and really looked at for any anomalies or viruses or any infection. So they're cleared to be safely used. So we do not anticipate any secondary effects or unwanted effects of stem cell therapy. Injection site, where we inject the stem cells, can cause some pain for 24 hours, but that's minimal. It's just an injection site. So we don't anticipate anything beyond that. If it's a joint problem, shoulders, knees, hips, many times we look at the MRI and we can see, like a roadmap, what to treat and where to treat. Other times, if the patients are diabetics and they want the diabetes treated, that's something that's more complex. And we have research programs which have dropped the blood sugar significantly with stem cells, but it's not a mainline treatment yet. It's approaching that point. We have good data now. Other therapies for other problems, for example, Parkinson's disease and neurologic problems, are not treatable at this point because we can't get to the cause with the stem cells. We need to be able to transfer stem cells directly to the area affected. And many times the big problem in neurology is getting to that site. The most difficult issue that we face now in 2023 and 2024, the coming year, is access to targets that we would like to reach inside the central nervous system. How do we deliver stem cells to areas that need treatment in the brain without destroying healthy tissue on the way? The treatment for Parkinson's disease will demand that we target a center in the very heart of the brain, the very middle of the brain, and restore that center. But how do we get there without destroying tissue? For example, to cure the Parkinson's disease, do we want to disturb the sight or the speech or hearing functions? So we have to be very aware of how to reach those target areas in the brain, and that's the problem we face. Many of our male patients ask me about how to treat erectile dysfunction with stem cells. We inject stem cells in targeted areas in the penis where there's a vascular junction. The stem cells enter the arterial circulation and venous circulation, and they correct the dysfunctional blood flow. They open up channels again. So it's really quite useful to use stem cells for that purpose, and the data shows now that it's very successful. Some critics of stem cell therapy say we don't have the scientific evidence that stem cells benefit us. Unfortunately, the problem is with the critics because they do not become aware of the studies that are available online and in medical libraries across the world. For example, when you inject a joint like the knees or the shoulder, which has a deficiency in cartilage where the cartilage is damaged, by injecting the stem cells and then doing sequential MRIs, you can see an actual thickening of the cartilage. Over a period of years, 2 years, you can see the cartilage and measure the thickness of that cartilage. So we do know stem cells work. Stem cells are now being used to treat diabetes. For the past decade, we've noticed that when patients were given stem cell IVs or injections, the ambient stem cells that were wandering through the body also brought the blood sugar down, and patients would state, I don't need as much insulin. When I give myself the usual dose, I'm having hypoglycemia. That means low blood sugar. So from these observations, and studies have been initiated, and they're ongoing now. And most of those studies are demonstrating that intravenous stem cells do improve diabetes. We know that diabetes is a very complex disease, and largely it affects the arteries. That's the main target of diabetes. So if the stem cells deposit themselves in the arteries, then we can see repair occurring. So the symptoms of the diabetes improve. We have yet, though, to treat the pancreas, where the cause of the diabetes is there. So the day will come, we're all looking forward to that, when we can transplant tissue into the pancreas and repair the tissue that's been damaged or that's being lost. We're not there yet. I have had stem cell therapy, injections of stem cells to my right hip, because I have a painful right hip where the cartilage is slowly being diminished from all of my fencing and skiing activities. Sports activities are a very known cause of destruction of cartilage over many years. I've done very well. I've had injections directly into the joint space with stem cells, and I have these injections every 6 months. Seems to have worked for me. I've also had stem cell IV therapy, which I really enjoyed. It was an easy experience, painless, yet I noticed really extensive changes. 6 to 8 weeks later, I felt much, much better, had more energy, and I was able to exercise more prolonged and have longer sessions of exercise. And many people come in once or twice a year for stem cells just to have a treatment because they want to maintain their liver, or they've had a history of hepatitis in the past. Or they want to maintain their kidneys, and they don't want to have dialysis in the future. So we do see patients who travel a great distance from China and from Europe to see us because they want to maintain their body and live longer. It's a way to delay damage and repair damage from. We have so much from toxins in the environment, cosmic rays, radiation, poisons, pollution, bad food. I mean, there's a lot of damage occurring in our body just from the impact of all of these things. So the stem cells can mitigate that. They can help that in many ways to repair maybe 25 to 30% of the damage. So we don't live forever, but it's a good way to extend life. You know, like you said, 120 would be nice, 110 if we can, you know, maybe longer.